Hey, everybody. Welcome to another episode of Clinic Gym Radio. I am your host, Dr. Josh Satterlee, and I'm here with two future doctors, Mai Thy Ta and Nolan Clausen, who are both students about to graduate from Cleveland Chiropractic College. Or I guess, sorry, that entity doesn't actually exist. Cleveland University, Kansas City, right?
Yeah.
All right. So, Nolan, since you're holding the microphone, we'll start with you. Give everybody a little bit of your history, where you're coming from and where you're at in your education here.
I'm originally from Nebraska. I went to Nebraska Wesleyan, an NAI school. I played football and basketball there. After I got my exercise science degree there, I went to Cleveland University, and I am in my last semester there and graduate in April.
And it's currently middle of February. We're at the Parker Seminar in Las Vegas. So what is that, 2.5 months away?
Roughly.
Yeah.
Less than 90 days.
You better know, homeboy. Life's coming up quick.
Yeah, it is.
And hand the microphone over to Mai. Mai, what's your backstory?
Yeah, I grew up in Wichita, Kansas, graduated from the University of Kansas with biology degree, and we're going to be graduating in April. Did a lot of leadership opportunities in chiropractic while at Cleveland. Did a lot of work legislatively as well as community building at Cleveland University. So really excited to see how that transitions into practice.
Yeah, you can't help yourself. You have to get involved in everything you can, right?
Yeah, that pretty much
sums it up.
Sums it up, yeah.
Like you recently went to NBCE, saw the board exams are made, and you went to NCLC for leadership summit, whatever thing.
Yep. And
awesome.
So a lot of cool opportunities to represent Cleveland, as well as get a lot of like background and stuff to see how it transitions. Really, really like what I'm seeing. I wish I could have more opportunities clinically. That's kind of something that lacks at Cleveland that I see other schools doing. More residency programs, more fellowships, more performance fellows at other schools that Cleveland kind of lacks. But really cool that SAC kind of opens those doors for you.
Awesome. All right, so slow down real quick. So probably people are wondering why the heck I have two students who haven't even graduated on my show. And here's the deal. I wanted to capture their input on what they see as the profession because, you know, I interview a lot of people who are 10, 20 years into the profession, sometimes more, and we're all influenced by, like, where we came from and where we're going. You guys are, you're Colombian grade cocaine here. You haven't been cut at the street level yet. You haven't been knocked down, and everything is possible right now, right? So I want to make sure that you share with us, and I hope to do the same interview maybe a year from now at Parker 2020 in Vegas so we can see how your first year went. But you can never go back in time, so we got to capture it now. So if I were to ask you, when you look out and see all the possibilities, Maya, I'll go with you since you just came back from all these legislative things. What are you excited about as you become a chiropractor?
What's really, really cool is a lot of people have said for years that this is the best time to be a chiropractor, and I think that it is more true now than ever. The integration that chiropractic is doing with other health professionals, where we are headed towards with working in the VA and working in Walter Reed and all of the cool things that the universities are putting out, that is the best time to be a chiropractor. We aren't on Chiro Island anymore. We can give the best patient-centered care through collaborative opportunities that never existed before.
Yeah, and are you seeing that? I mean, so you're seeing it around your school in Kansas City, but when you go to NCLC and these other national organizations, do you see people talking about those opportunities in other geographic locations? Yeah,
it's actually really cool. We just had our leadership conference for the Student American Chiropractic Association last September, and the ACA is actually creating an initiative to have a intra-professional conference as well as FTCA. Both of them are moving in this direction, and so you are seeing a lot of integration happening, not only with the new grads, but these seasoned doctors are starting to move that direction too, and that is really, really cool.
Fantastic. And hand the microphone off there to Nolan as I dive into him. But one of the things I think that's exciting is we're no longer like, we're getting everybody to play nice in the same sandbox instead of saying like, no, we play in our own sandbox and you can't play in it. So I think that that method never gets anybody that far along when you try and exclude people. It has a funny way of excluding you more than anyone else. So, Nolan, you're an athlete, played in college. Your wife played in college as well, right? You've seen all that. What are you thinking about, like, chiropractic in the world of athletics? What are you seeing there?
I see only potential. There's a lot of people, they're handling the
Be careful how
training.
you say that, because that's like coaching code for this kid sucks, right? Oh, well, he's got a lot of potential. That means I hope to work with him over the next 3 years to maybe get a 500 season out of him.
Very true. I guess in my light and the way I look at things, I see the potential because there's really a lack of what's out there for sports chiropractic, sports performance, all that. I know a lot of students, in fact, like myself and multiple of my friends and colleagues that go to the same continuing ed courses on the weekends, we were drawn towards this profession because we were, athletes and we were interested in the performance side. And you go through the curriculum at school and you start to understand, well, there's nothing out there like that right now. Nobody's creating those kind of jobs. But there's this pain thing. We can help people get out of pain, and we can definitely, treat everyday people that are, working out and they have pain and all that stuff.
Right.
But in the world of sports chiropractic and performance, there's nothing out there. Like, there's no jobs. So
Not yet.
Not yet.
I mean, part of the problem is, like, the term sports chiropractic is not well defined, but I wouldn't say that that's limited to chiropractic. Like, if you go to sports physical therapy, there's a whole section, the SCS designation in physical therapy. I think it's sports something specialist. And, I don't think the public knows what that means. That certainly within physical therapy they do. But when you go to these different, like, continuing education seminars, and you've got to be sitting next to physical therapists and physical therapy students, right?
Yeah.
Do you do that?
A lot of them.
Yeah.
Are.
And is the language at least unified? Like, we're all saying the same, like, describing things similarly, and it's not a big, like, you guys stay on that side of the room, we stay on this side?
Definitely with the continuing ed courses that I go to, we are definitely talking the same language.
But it's a huge I mean, you guys probably have only seen that version of it, but it used to be like a version of, like, we say subluxation and you say joint restriction, and we disagree wholeheartedly on the fundamental, what that means. But I think we're past that now.
Yeah, absolutely. First year of school, one of my best friends went to PT school, and we would, bicker and rant back and forth at each other and send nasty text messages about each other's profession.
Yeah.
And it's funny, he's graduated now and he's in the field, and I bet we share more information, educational things with each other than we ever did when we were in undergrad together and studying together every day.
Yeah, it's funny. Like, it's like those anatomical bodies exhibit. You take the skin off and you can't tell where the person's from or what they're. It's like, oh yeah, 99% of the stuff's all the same. I think we just decide to make it different at some point. So you see a lot of potential for that kind of that development of that idea, that profession in sports.
Absolutely.
Is there anybody doing it well? Like, are the physical therapists doing it well in your perspective, or strength and conditioning coaches? Who's progressing and getting towards that performance model?
There's a few out there right now. One that comes in particular is Brett Winchester. He's doing a really good job
Brett's
of that.
been on the show. Don't kiss his ass just because he's a mentor of yours. Like,
I kind of have to. So.
Yeah, I know. But he's going to listen to this and he's going to think he's hot stuff, But I don't want him to get the wrong idea, But yeah, he's certainly a guy that knows what he's doing, and he's doing it well and working with a lot of sports teams and whatnot, right?
Yeah.
Yeah. But again, like, I think he's a chiropractor that went to achieve that. I don't think that I think he would have done that no matter what his license was. If he was a physical therapist, he still probably would be doing very close to what he's doing now, because he's a little bit of everything, right? He's a little bit of physical therapist, he's a little bit of a strength coach, a little bit of rehab guy, manual therapist, all that, probably psychologist as well. He has that crazy kid, Taylor Premer, working for him, so definitely has to cancel him.
Yeah.
Yeah. All right, so Brett's a good example of that, and let's go hand the microphone back to Mai, because I don't want to exclude the token woman we have here. I don't want this to get all broed out on sports, but don't go any farther. So what do you see developing in the profession, by the way? So you've been around, like, so there's this, like, commonality that happens, like, when legislators get young, pretty females around them. They kind of spill the beans. So you definitely have more of a line here than what Nolan and I hear, right? But what's out in the future as far as certifications and designations and things like that? What do you see happening in this world?
Yeah, so the biggest thing is people are starting to look towards what is best in the face of the opioid crisis. And this is not a profession-specific thing. This is a health field thing. And so people are playing nicer because we're in the presence of something that is so detrimental to our society. And so what is really, really cool is for the first time, people are doing more research to create these clinical guidelines that say, hey, what conservative care can do in the face of the opioid crisis, despite if you're a PT, despite if you're a chiropractor. We need it. We don't care who you are, we just need it.
Right, it's like, the house next door is on fire. We don't care how you bring water here in a hose or in a bucket, just get water.
Yeah, absolutely. And so that has created a lot of legislative fronts, and momentums that we are doing. The Medicare bill that is going in, which would allow chiropractors to get reimbursed to the extent of their scope, would be an incredible achievement for us, because where Medicare goes, insurance follows. And so, like I said, the best time to be a chiropractor. And what's really cool talking about the sports thing, though, where you guys were going towards the conversation, there is not a profession right now that is the sports performance profession. Mm-hmm. And so this just opens more doors for us. And that just allows us to be, the recognition of the person that is taking care of performance. Yeah. So, yes, we could open the door with the opioid crisis and help make a dent in what is going on, but that just opens the conversation that we could also be the performance experts. We can take care of the pain. Let's take it to performance.
Yeah, it's kind of funny because if you step back for a second, I'm thinking about this. You just brought that up. I think it's a great point. Is if you look at the core issue with the opioid crisis and performance, or it's usually that at some point you had a patient that was complaining about something, and then the provider just basically threw their hands up and was like, whatever. Just like, here's what you do. Here's what to do. And it happens with people, like they get ACL surgery, they go through rehab, and it's just like at some point somebody throws their hands up like, you're not getting any better. And that person goes on to like study why didn't I get better, and therefore how do I build performance in others. But in opioid crisis, it's like I don't think anybody along the first one or two providers they have, I don't think there was malice in them. They probably wanted the person in front of them to get better. The person kept talking about pain, and they're like, well, I don't know what to do. Here's more and more and more drugs, and I don't know, they seem to work for a couple days, and but they don't realize that they're creating this it's like when you have like a scab, and then you pick the scab, and then you pick it again, and then you realize pretty soon you got this huge thing going on. It's like, dude, that wasn't my intent. I just started off because it was itching a little bit. Yeah,
it's just a positive feedback loop right back into that system. So with these clinical guidelines coming out, support your state associations that are pushing out this information. Be the first line of defense, and then be a part of that collaborative team that when in doubt, you're ready to refer, but be the first person to try something conservatively. Yeah. And that is going to be just a door opener for the entire profession.
Yeah, I think one of the greatest parts of our license, too, and I would give this to physical therapists as well, and anybody, like the ability to have that person in pain in front of you, or that person wants performance in front of you, and it's what can you do for them right now with what you have. Not, let me refer you for an MRI, it's going to take 2 days, and then you're going to come back a day after that, we're going to interpret it, and then we're going to decide on a treatment plan, and a week later, even though you're dying in pain, we'll have a clear treatment plan of what it is. It's like, slow down. Like, how about that person comes in right now, I put my hands on them, I do an evaluation, I figure out what's going on, and I do some treatment right now and guide them through some exercises right now, and in an hour, not a week, in an hour they're different, versus the kind of crazy long version of how to get to the starting point that some professions end up getting into, right?
Yeah, it's super helpful that we're portal of entry physicians, and everyone thinks there needs to be...
This is how Mai has been around, like, the legislators and stuff. We're portal of entry physicians and primary providers of care. Yeah,
for sure. But the thing is some, chiropractors are like, there should be a schism between us and the PTs, but with what we're dealing with and the population base that we're seeing and the percentage of the population we're seeing, I mean, if we're playing nice, we still wouldn't, your doors are still going to be packed. People are still going to be banging down the door. When low back pain is the number one disability in the world, you are going to run out of patients if you are doing things ethically and collaboratively and you're playing nice.
And those people don't give a crap about what your license is. I mean, they're just like, can you make me better, yes or no? And it's like, well, I have these certificates. Like, that's not what I asked. I asked, can you make me better, yes or no? And I don't care. They don't care if you want to do that through McKinsey protocols or the CRISP protocols or DNS or manual therapy or, like the pain science folks, like that kind of approach. It like all that they care is 2 weeks later, is my pain significantly less and is my ability to do daily life significantly higher? And it's like, if yes, then whatever your profession is, I love it.
Yeah.
I don't know what it is, but it's awesome. Yeah.
Absolutely.
How about you? You want to talk? Nolan's a little more hesitant. You can see Mai's been in front of some crowds and done the leadership role. But as far as performance, I think the same thing holds true about like they don't care, right? Like, I mean, literally there are strength coaches providing more care on the front lines than any other profession in their area because it just by default they had to do it, right? Like nobody else was doing anything good.
Yeah, exactly. And that goes to like one of my favorite quotes by Dr. King, and it's people really truly
You're gonna go
don't
far in
know.
life because you kiss so much butt, dude.
I know.
You got Winchester on here. You got King. Like, man, name dropper extraordinaire.
Hey, I don't have an original idea, so that was another quote.
Awesome.
But people really don't care how much you know until they know how much you care. And so if you can provide care that actually gets them better and do all those things, it doesn't matter what your title is.
Yeah, I mean, like massage therapist or any of those things. It's funny because like I saw this study. It was like massage therapy versus primary care MD versus physiatrist or PM&R versus chiro versus PT versus yoga instructor, and the highest rank of all of those people in the highest patient satisfaction numbers were the yoga instructor. Like, oh, they took time and they explained it to me and they used external cues like, shape yourself like a wheel or here's boat pose. But it was about that. It wasn't about you as a patient not being able to do that. It's like, hey, work towards this. And you can't get there today, but that's okay. This is practice. And it's funny because everybody else has formal training and they're like the least, I mean, they do a 200-hour, 400-hour certification. But as far as patient care, the least trained, and they're just like, oh, I know what I'll do. I'll actually treat these people like human beings. And all of a sudden they have these miraculous patient satisfaction scores. So we should take cues from that and realize, first, talk to this person like you would your own mother, not, beating your chest about your certifications or your abilities or whatever.
I think a lot of that can come from, our education. You go through 4 years of school or less or more, and we're talking about the avatar, the patient, as what would we do for this patient? We don't talk about them as a person. And
right.
so
it's
a
like
lot
that
of
scene
times,
in Patch Adams. You ever seen that where he's like,
yeah,
does the patient have a name? Like patient 473. They have a name? What do you mean? Like a first name? Do they have one? And they're all confused by that question. Like,
yeah. And I think that's one of our biggest problems, like just within school is, we go through the education, but a lot of these students really haven't touched anybody outside of school. When we go
and they're all healthy, highly resilient, 26-year-old, quote-unquote patients, right? Practice patients. It's like, oh, yeah, you can insult that body a lot before they get pissy.
Yeah.
And they'll be fine tomorrow. Don't worry.
Yeah, the best students that come out of school are the ones that, have gone outside of just the school system to find ways to get their hands on people instead of waiting just for when their clinic hours start.
Nice. Well, for those out there who maybe want a preceptor or want some young, hungry students that are willing to work their butt off for essentially $0, right?
Yeah.
What, when you look back like not a year ago, 6 months ago, what were you looking for in a preceptorship? And what have you heard from your fellow schoolmates that would make you think like that was a effective, exciting preceptorship? Basically, what is the bait that people on listening here can put in the water to attract the best preceptors?
I would say, well, I guess this doesn't really answer your question, but a lot of students pick a preceptor based on the pretense of, is this going to provide me a job? Am I going to make money right away? A lot of them don't actually go out and shadow docs beforehand They just pick somebody, and they think it's going to be a great experience, whereas they didn't, I think the student needs to vet the doctor just as much as the doctor needs to vet them.
Yeah, in private practice, we call that hiring. Like, anything that can fog a mirror, we're like, oh, congratulations, you won the job at the front desk. And they're like, might not even be good at that. It's like, we don't care. You were here. We need it now, and so we'll do that. So they're often approach preceptors the same way?
Yes.
Yeah, one of the problems, and I would actually throw this to you, Mai, like, one of the problems I think that the people listening, though, are going to have is how the hell do they, if they're not in the same neighborhood as a school, right? So if I'm in Las Vegas, there's no chiropractic college here. How do I reach out and put the bait in Overland Park, wherever you are, in St. Louis for the Logan students, or in Southern California, home of the championship chiropractic college where I went, SCUHS? How do we get, that's right, smile. You know it's true.
Never heard of it.
Skew.
Skew the results as in great, amazing. Hey, it's Dr. Josh, and real quick, we'll get right back to that interview, but I definitely want to tell you all about our Super Conference. It's coming up on April 13th and 14th in Austin, Texas. Now, what is it and what makes it so awesome? Well, it's super. That's why it's called the Super Conference, and it's super because we've combined two of the greatest models in all of the clinic gym hybrid space, and that is the Accelerator program. We are putting it live into an event, and you're going over everything we cover in an Accelerator live. Now, we can't go as in-depth as the online training, but we're going to give you an overview on Saturday about how to run the business side of the operation. And then on Sunday, we have partnered with the CFSC, the Certified Functional Strength Coach Program, and they are teaching a course all about the exercise to do and the progressions and regressions to do with your clients. So you combine those two models, the best exercise program with the best business model, and you have an absolute super conference. So I hope you can join us April 13th and 14th in Austin, Texas. Go to our website, clinicgymhybrid.com, and look for the button that says Super Conference. Once again, clinicgymhybrid.com, and there's the button right at the top that says, tell me about the Super Conference. Click there. You got all the info. Thanks a lot. We'll get right back to that interview. So anyways, if you're not near those schools, how can you get the word out that you're looking for a hungry young, preceptor? How can you get contact with those students?
Yeah, I think that the biggest thing that for sure Nolan and I have seen as we've gone through our education is even when we started as Try One new students, there was a lack of doctors who got involved within the universities. And so we got exposed to someone coming in and bringing in pizza, and we believed everything they said, and it's pretty rough. If we had more doctors, especially functional doctors.
Did somebody walk into Little Caesars going, I heard you guys have a preceptorship here?
No?
Oh, it's Pizza Hut, sorry. That Papa John's dude, he's a good chiro.
Oh my gosh. Yeah, but we having more doctors get involved with the school and the community, helping student clubs by sponsorships, or even having opportunities to be like, hey, if you want, we could do a webinar series or a Skype call, and getting involved with these students. We are hungry for it. We are always being involved in as many clubs as I am. We are always looking for doctors to step forward and volunteer to do those kinds of things. And it's so much more receptive to have that human connection with these students.
Oh, for sure.
To ask about these preceptorships than just, posting. I see it a lot. They'll post on our educational boards, like our feeds on Facebook and stuff, like, hey, we have a preceptor here, and it's just like, who are you? Like, what are you even? We don't understand what you want from us, and it's kind of a shot in the dark. And for these places that you're asking us to move, and you're asking us to come work at your clinic, if you're not by a university, if we never had that human connection with you, the likelihood of us coming out to see you is pretty slim. And so if you can even have the human connection of being reaching out to the school and helping a club provide pizza, it's a small donation, $50, $25, to back to the school, and creating that relationship, that is going to be volumes. Then you can invite them to come shadow your office. The students will drive. I mean, Nolan has driven how many miles? I would say thousands.
You went to our
shadow.
main man, Kurt Kurt Kippenberger's place, right? Or you
Yeah,
did too,
we
Mai.
both
That's what, a
did.
3-hour drive for you guys?
Yeah, it's a 3-hour drive, and it was because Dr. Kurt reached out to us, invited us to go see his clinic, and man, that connection, I got to meet him even before that, and that connection made that drive worthwhile. And then I saw how amazing his clinic was, and I mean, that's what we need to be doing.
And to his credit, I mean, I have like a man crush on him, you know, like I like the earrings, I like the short hair. But seriously, I think he's done many things right. One of which is he tells the preceptors, look, we have like a housing stipend because I know that you're only going to be here for 4 months roughly. It's not like you're going to get a 4-month lease on a new apartment, move all your stuff from, in your case, Overland Park to where is he, St. Louis or whatever? Columbia. It's not like you're going to do that for a 4-month experience and then move on, right? But he's like, yeah, like I realize you'll provide service and probably work your butt off, so I'll kick down what are we talking about? An extra $300 a month? I mean, nothing crazy, right? I'll kick down a little bit of money to help you live here so that I can get somebody who's motivated and hungry.
Absolutely.
And, and it's like, yeah,
that's the thing. If you
it all works well together.
Yeah, absolutely. If you're looking for the cream of the crop, you got to do something. You can't just post on a Facebook page that you're looking for a preceptor. And that's what you want. You want those young people who are hungry, who are going after getting more knowledge outside of school, investing in their education for their future patients. And you are only going to get that by investing in some way.
Yeah. All right. Now, I'm sure a lot of listeners are going, that's great, fantastic, but I live in Denver and there's, it's really hard. So I would like you... So, like Nolan was involved in the DNS club? No.
We have a DNS kind of club, and then MPI club.
MPI, Motion Palpation Institute, right?
Yep.
That's the one you're really heavily involved in?
Yes.
That's why you kissed the butt of the two big guys at the top?
Yeah.
Yeah, okay.
Absolutely.
But in all seriousness, if there's somebody that is like an MPI person out in the field or DNS, and they want to connect with these students to be part of that club, how would you suggest they actually do it? Like, if they were to start today, how can they find a way to connect with that club for a conference call? Because you guys have been on like Zoom calls, right? With Jason Holm, for example, did one with some people at your school, right?
Yeah.
And then you've had people on site do presentations and whatnot, right?
Yeah.
I'm trying to give them the exact steps to get to that they can actually get in front of these students to get that human connection that Mai talked about.
Like you were saying, the Zoom calls, share some of your knowledge. We're students. We don't understand the business world. We don't understand what it's like to be, out on the street. Like you said, we're Colombian grade A cocaine, but we haven't been cut.
Yeah, you're still white as driven snow.
Yeah. And so we look for all the free information that we can get. Free is good to us.
Yeah.
We got a loan debt.
So can they? Yeah, exactly. Don't worry, the people listening still do too. But can they? So would a good contact be reaching out to the MPI club president at Cleveland University, or reaching out to you were SACA?
Right, I was SACA chapter president.
Don't go
so
too
there's
far
a couple of ways. There's a couple of ways that you can get involved with these student organizations. On every school website, there is a place that you can go. It's usually under student life or campus life, and it will tell you all of the approved student council or student sanctioned clubs that are on their campus. And usually there's contact information either by the club itself or their director of student services or some terminology likewise of that position who could get you into contact with the club president of your interest. So let's say you would like to champion a topic on intra-abdominal pressure and breathing. Usually they'll tell you, that would be someone we could do with MPI Club. I'll refer you to them. And just utilize your resources of the school website, or even if you can get into contact with national organizations such as the Student American Chiropractic Association. FTCA is now having student chapters at some of these universities, and getting into contact with them, they can point you in the right direction.
And if you went onto like Cleveland's site, you would see the same name keep popping up 14 different times on head of student council, SACA, which Mai held all those positions. But in all seriousness, if a person, before you came along, I'm sure there was a person that held multiple things listed on the same site, like president. It's like MPI and president of DNS means that person is well connected with the students, right?
Absolutely.
Just as an example. I don't know if that person was the same. So that may help you get to somebody who can actually make some stuff happen, right? Yeah. So what are some more of the active clubs at Cleveland that would be good for these people to reach out to?
Like you said, I'm heavily involved in MPI, so I would say that's number one. SACA is definitely one of them. There's really not too many clubs.
So just the ones you're part of are the cool ones.
Absolutely.
And everything else sucks?
Yeah.
But can you think of any others?
But like you were saying...
and it's weird, though, because like I went to school at SCU. Like, we didn't have an MPI club.
Yeah.
Right? We had a Gonstead club that was super powerful.
Yeah.
And for whatever reason, I'm sure 3 years later, the Gonstead club's tiny, MPI is huge. For you guys, you brought your SACA, I'm looking at mine now, your SACA program while you were there grew and grew and grew. And I'm sure 5 years before that, SACA may not have been as powerful. Maybe, dare we say it, SICA may have been like the bigger organization, but it really has to do with the involvement of the people there that seems to grow these, right? So whatever, if you're listening, whatever you're involved in, if you're like, I went to a DNS seminar, hit up the DNS club, or if I went to an MPI seminar, because now you have a unified language that can open that door.
Yeah. And say 10 years from now, I'm looking to hire an associate or a preceptor. I know the first call I'm going to do is the president of the MPI club at Cleveland. I'm going to call them and say, who are your top people that come to club, the smart ones, the ones that are willing to lay their neck out on the line for you.
Yeah, and they'll be like, who's this? Never heard of you. You'll
Doesn't
be all
matter.
offended. Yeah, you'll be all offended. They don't remember you. What? You'll be like Al Bundy. 30 touchdowns at Polk High. You don't even know that show, do you?
No.
Awesome. Well, it's great. It's great interviewing 26-year-olds that have no idea of the references I make for what was funny growing up. So, fantastic. All right. Well, so we're here at Parker Seminar. Anything that you're looking at this at the like program of all the speakers available? Anything you're looking at going, wow, I never even thought we could get into that, or that's really exciting to me? Like, what gets your motor going? Because you guys have been exposed to some of the most quote-unquote cutting-edge stuff, right?
The McKinsey tracks, I like those. Some of Dr. King spoke earlier today. There's a 3D motion capture speaker, so that's something I'm interested in looking at, especially with the sports performance side.
Yeah.
And then there's some other guy speaking later on Saturday.
No, he's speaking at the same time as that 3D motion capture guy.
Yeah, I guess I won't be able to.
Yeah. Well, he won't even let you in the room. For those of you listening, that's me. I happen to be up against that 3D motion capture, which is ironically the same session I want to go to, but I got to be up on stage. So, Mai, how about you? Anything you've seen that kind of gets your motor going?
Yeah, I think that the lineup for Parker Seminars has been really, really moving in a progressive fashion under Dr. William Morgan, and just Parker as a university.
I'm glad that we couldn't get out of the Ask Us rodeo here, right? Like, we almost got bucked off, but you're back on the horse.
We got to talk about Dr. Morgan.
No, he's incredible.
You got to remember, we don't have a platform to stand on yet.
But it's really, really awesome to see such a progressive university moving the curriculum. He even said that the standards to get into Parker have actually gotten a little bit more rigorous and has actually caused more influx of students. And so holding our profession to a higher standard with the direction that Parker is going has really, really been cool for us, because we have had tons of rants and conversations about how the chiropractic schools are too easy to get into. It's not challenging us. Students are coming in not knowing what they're getting themselves into, putting themselves in debt, and then failing halfway through the curriculum. And so that was really awesome. Seeing also that the evidence and the guidelines are starting to move to show that what we do paired with exercise and movement and mobility is what's best for the patient. And so these tracks are doing clinical the clinical tracks are more towards doing more rehab and exercise, and Stu McGill is here, Liebenson's here. this is where the profession is going, and that is very, very, very cool.
Yeah.
It just diversifies what the professionals are doing in this profession.
Awesome. Well, I thank you guys for being here on this interview, because I know that it's an exciting time. Like, you're at this point where you think, like, all the debt that you have now will be repaid within 18 months, and you'll be happy as clams, right?
That would be amazing.
Yeah.
We both just did our exit interview for federal loans, and I might have shed a tear a little bit.
They keep writing zeros after your day. You're like, what? Anyways, well, it's an exciting time. I've certainly been blessed to know both of you. I'm excited about your futures and what you'll be able to do. So congratulations. And anybody who wants to reach out to you guys, would you mind sharing your email, a non-Cleveland email, because that one only will work for 2.5 months. But seriously, if they're like, hey, because you guys will know who's behind you 3, 6, 9 months, right? Like, who might be good to reach out to?
Absolutely. You can contact me at Mai Thy Ta 12 at gmail.com, and I'll spell that for you.
Thank you.
MAITHYTA 12 at gmail.com.
Why the hell did that need the 12 at the end of it? There's no way that anybody else said. What?
Yes.
I don't believe it.
No, there absolutely was. And then actually, my birthday is on the 21st. And so I was going to do Mai Thy Ta 21, and that was taken.
Wow. So sad. You just can't have a unique name these days. How about you, Nolan?
Yeah, if you want to reach out to me, my email is nolanclausen at hotmail.com.
Can you spell that for everybody?
NOLANCLAUSEN at hotmail.com.
All right. Very cool. So people might send you emails and just say, hey, I heard you on the podcast. I just want to know who to contact. You guys would be fine with that, right?
Absolutely.
Awesome. Well, thank you very much. I'm excited for this weekend here at Parker Seminars. And on behalf of Nolan Clausen and Mai Thy Ta, this is Dr. Josh Satterlee saying, go out there, maximize your license, and live the life you dream of. Thanks, guys.
Hey, how about that? Another great interview here on Clinic Gym Radio. Listen, if you're serious about starting up your own Clinic Gym Hybrid, then please go to clinicgymhybrid.com and check out our website there. We also love to get you involved in our accelerator program, which will walk you through step-by-step the 42 pieces you need to start your own Clinic Gym Hybrid. I'm Dr. Josh Satterlee. We'll talk to you later.